Coronavirus disease is an infectious disease caused by a newly discovered virus. This virus can be found in animals, and hardly can be transmitted from animals to humans and then spread person to person. Health officials do not know what animal caused coronavirus disease 2019. Most people infected with this virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people, and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. Older adults become more susceptible to infections due to several factors. The combination of increased comorbid conditions and the decrease in activity of the immune system can make people more prone to infections. The virus is thought to spread mainly from person to person between people who are in close contact with one another, within about 6 feet, or discharge from the nose when an infected person coughs or sneezes. Protect yourself and others from infection by washing your hands or using an alcohol-based rub frequently and not touching your face. There are 3 main symptoms of this disease: dry cough, shortness of breath, and fever. The Centers for Disease Control and Prevention considers a person to have a fever when he or she has a measured temperature of at least 38 degrees Celsius. Those with weakened immune systems may develop more serious symptoms, like pneumonia or bronchitis. You may never develop symptoms after being exposed to coronavirus disease. So far, most confirmed cases are in adults. There is no evidence that children are at greater risk for getting the virus. So to avoid coronavirus disease from happening, try to avoid people who are sick or meeting in large groups. Cover your cough with a tissue and do not cough into your hands. Wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating and after blowing your nose, coughing or sneezing. If soap and water are not readily available, use an alcohol-based hand sanitizer with at least 60% alcohol and avoid touching your mouth, nose and eyes. There is currently no dose or treatment for coronavirus disease 2019. Symptoms of a coronavirus usually go away on their own. If symptoms feel worse than a common cold, contact your doctor. He or she may prescribe pain or fever medication. If you are having trouble breathing, seek immediate medical care. When possible, avoid contact with others when you are sick. If you have coronavirus disease, wear a face mask to prevent spreading the virus to others.